one thing that I think everyone has to do is to start listening patiently to actually what the other person is saying, and to start having dialogues where you also don't agree with each other, but you're listening and you're respecting each other. I think somewhere that loss, and this is not just in health, but it's in every sector, that loss of that sort of mutual respect, that sort of, I shouldn't call it tolerance, but I think the loss of the fact that different people can come together and have conversations. I think that's the biggest challenge that we have. And I think if you can do that one thing, just that one thing, I think a lot of the other issues that are there can, there will always be hope. There will always be someone to listen to you, and there will always be someone to respect your opinion. So I think that would be the one thing that we need to do.
I think we need to look at health very holistically. The sad part of how people are performing their jobs, they're well intentioned in many cases. Many people are well intentioned. Many government departments may be well intentioned, but they have a very narrow, blinkered view of their tasks. I mean, if you say, oh, I'm in the health department, I only have to look at this. I only have to vaccinate so many thousands of people and ensure that so many deliveries take place in institutions. And it's as if that task is somehow not connected to the other things. You have to look at health really holistically and look at it as, look at all the background that goes into health. There's nutrition, there's shelter, there's safety, security, freedom from crime, freedom to express yourself socially, pursue recreation, get education, get employment. So those kinds of things. I mean, looking at health holistically, looking at human health in all the physical and social environment, not to forget the earth. I mean, we are doing things which have global impact. So we need to look at things very holistically and see what all contributes to the impact that we're looking for. Like if you think you want this set of people to be healthy, what all will contribute to that? And in the procedures that you follow, what all are the impacts that you will have, adverse and good, and then weigh them and make a decision that is unlikely to have an adverse impact on something just to get you your good impact. Because there are solutions that can be good for many things. It requires a lot of thinking and strategizing, but that is what we need to do.
Maybe I will tell two things. So one is acceptance of sexual and gender minorities, because that's my health equity focus. So because right now it is primarily discrimination which is actually leading to most of the health inequities we see. So acceptance, so promoting acceptance of sexual gender minorities is one, and another is giving them the full rights to be equal citizens as that of other people. Only recently, like the trans people, they also got the right for say vote, or right to get education, or even right to have a gender identity. So this needs to be realized in practice, not just on the paper or in the Supreme Court judgment or in the bill, but how we convert that into actions again. So these two things, acceptance and then promoting rights, promoting their rights so that they can be full citizens.